Good afternoon, good morning, good evening, wherever you might be. Welcome to the Asia Global Institute and welcome to this Asia Global Institute, Asia Global Fellows webinar, Sick in the City, Public Health, Wellbeing, and Urban Design after COVID-19. The AGI cross AGF webinar series is an intellectual exchange platform for Asia Global Fellows globally to interact with the leadership of the Asia Global Institute and the Institute's network of experts on important global policy issues. So welcome. COVID-19 has placed significant stresses on people's physical and mental health, revealing gaps in public health delivery and the design deficiencies of cities. The pandemic required social distancing and self-isolation, but often in crowded communities or urban areas with insufficient spaces for relaxation and leisure activities, and without the necessary support services and safe transportation systems. As the coronavirus catastrophe and the economic crisis it caused recede, although with Omicron, we now really don't know when this might happen. How can communities build back better and provide the facilities and amenities necessary to accommodate public health needs and promote the well-being, including the mental health of individuals and families? So let's start. I will introduce our panelists in the reverse order in which I will engage them in conversation. May I remind you, our listeners, our audience, to please use the Q&A platform to send us your questions, and we'll try to fit in as many as possible. Now, let me start with Dr. Amit Wanchoo, who is a 2018 Asia Global Fellow of the Asia Global Institute at the University of Hong Kong. Dr. Amit Wanchoo is a medical doctor, entrepreneur, and social activist. As I mentioned, he's an Asia Global Fellow. He is founder, chairman of the H.N. Wanchoo Trust, which operates an ambulance service in the Kashmir Valley. And he's also CEO of Space Communications in Srinagar. Dr. Wanchoo has written regularly for Asia Global Online, including articles about living in lockdown, learning from the Kashmir experience, the coronavirus and the poor, the high socioeconomic cost of social distancing, and an article about the India-China conflict. Second, let me welcome Jeffrey Kok Hui Chan. He's an assistant professor at the Singapore University of Technology and Design, SUTD. His research focuses on design ethics. He is the author of Urban Ethics in the Anthropocene, The Moral Dimensions of 6 Emerging Conditions in Contemporary Urbanism, published in 2019 by Palgrave Macmillan. And he's co-author with Zhang Ye of Sharing by Design, published in 2020 by Springer. He too has written regularly for Asia Global Online, including pieces on the urban ethics of COVID-19, and an article on rebuilding cities better in the post-COVID-19 world, as well as an article on adding value, living with intelligent machines, and a article on a roadmap to build back better, to build back right the sharing city. Finally, we welcome Layla McCay. Layla is a 2017 Asia Global Fellow. She is a British medical doctor and global public health and health system specialist. She is director of policy for the UK's NHS Confederation. She is also director of the Centre for Urban Design and Mental Health, an international think tank which publishes the Journal of Urban Design and Mental Health, of which she is managing editor. Dr. McCay has worked for the British government's Department of Health, the World Health Organization, the World Bank, and several international NGOs, and was named the UK's top young professional woman for her impact on health. She has a bachelor's degree and medical degree from the University of Glasgow and a master's degree in health policy planning and financing from the London School of Economics and Political Science, and the London School of Hygiene and Tropical Medicine, and has been an adjunct professor of international health at Georgetown University. Dr. McCay has expertise in intersectoral collaboration to advance public health, advance public health and health service innovation. She's based in London. Layla has also contributed to AGO, writing in August a piece on designing mental health into cities, which was based on her recent book, co-authored with Jenny Rowe, of Restorative Cities, Urban Design for Mental Health and Wellbeing. So welcome, Amit, Jeff, and Layla. It's lovely to have you. Now, Layla, if I might start with you, I think mental health and urban design, it doesn't come obvious to most people as an important kind of, that there's a nexus there. And in your article that published in AGO and then your book, you talk about different kind of frameworks of cities, sort of restorative cities, green cities, blue cities, sensory cities, active cities, even something called the playable city. I'm wondering if you'd talk about this, because this is in many ways such a cutting edge field, and people don't really think about, urban design. We need to think about this for mental health.
I think that's absolutely right. I'm sure that many people here have heard about urban design strategies for healthy cities that are largely focused on physical health. So, for example, how do you design a city that reduces chronic health conditions like obesity or reduces breathing problems, those sorts of things. But there's this huge opportunity to design cities that improve people's mental health that can have a huge impact on the population. But until fairly recently, I think that people have struggled to know how to approach this from a planning perspective, from a design perspective. And I think that there's been this feeling that supporting mental health has been about medicines or hospitals or therapy. And having good access to mental health care is incredibly important. But there is this opportunity to have a wider health, public health impact by leveraging the built environment. I think that's what I'm particularly interested in. So in my book that you just mentioned, Restorative Cities, we propose a framework by which people who are developing cities can really think about how to implement a more mental health friendly city using the very best science. And that science is coming. It's so complex because, as I say, this is a fairly new area. So the science is not all in one place. What I've been doing is pulling it together from architecture, from psychology, from psychiatry, from public health, from geography, from engineering, all these different disciplines, bringing it together to come up with this restorative cities framework, which has 7 components. I can give them to you in any level of detail, but just to kick us off, I'll just tell you what the 7 components are. Is that
Sure,
helpful?
Sure. In fact, I missed neighborly city.
Yeah, exactly. So I think that the first one is green city. So that's about green nature. There's some of the most evidence is around having natural environments that are accessible, that are of high quality, that have biodiversity, that are well maintained, that are close to people's houses. And there's lots of research that's showing us that can reduce the severity of depression, of stress, of anxiety, ADHD, of dementia. And of course, it can mitigate things like heat stress and improve sleep. So investing in green space is very well known to be beneficial for mental health. And within the book, I sort of look at the details of how to do that effectively. The blue city is essentially the water aspect of nature. And again, it's been very well known for so many years that water can benefit people's mental well-being. But I think it's more recently that we've seen the science behind that. And again, it's about maintaining it, having good access to it, being nobody's going to have mental health benefits from stagnant, dirty, polluted water. But if you can really take advantage of those water assets in your city, then you can reap those mental health benefits that can have all sorts of benefits from health itself all the way up to economic benefits. The sensory city is kind of a new one because quite often designers and planners will think about senses in the context of people complaining about something, so noise or a bad smell, but there's actually these opportunities to seize on design that is pleasant to the senses and can create feelings of place identity and belongingness, and using visual complexity to help reduce feelings of depression, which is really interesting. The fourth one, as you said, that's the neighborly city. I think it's not news to anybody that if you have strong networks of supportive social relationships, you are less likely to develop mental health problems, you're more likely to recover from them. And we know that social isolation and loneliness can be a risk factor for developing those mental health problems. And studies are telling us that the risk of loneliness is so much higher in cities than it is in other parts of the world. What is interesting is the growing evidence of the role of urban design and planning in helping to grow people's social capital, reduce loneliness, support mental health. The fifth attribute is the active city. So that is integrating physical activity into people's everyday lives. You might think of that as being a physical health intervention, but the science is now telling us that actually there is a mental health benefit component to that as well. Can reduce depression and anxiety, improve stress regulation, and improve brain function. So there's lots of exciting opportunities there. The playable city, as you mentioned, is thinking about how can you integrate play into the city, not just for children, but for all ages, because we know that engaging in different ways with your settings and surroundings can be beneficial for your mental health. The seventh and final attribute is the inclusive city. So that means that designing a city that is inclusive for all ages, all genders, all races, ethnicities, sexual orientations, all socioeconomic strata, for the full diversity of physical, sensory, cognitive abilities and needs. We know that, of course, urban design does contribute sometimes to segregation or exclusion or prejudice in the cities. And really sorting that out is incredibly important. And, you know, bringing the people who use the city into the decision-making and design process of how to develop the city is a really important thing. And I'll just finish this little brief summary by saying that all of those components bring together a few different mechanisms that are thought to be how the urban design can impact positively on mental health. One is fascination. How can you design that creates wonder and curiosity? One is compatibility. So is the city a good fit with your personal needs? Being away. So a sense of escape from the everyday being available.
Right.
And then extent, which is looking up and out. And those are really the components that make up the restorative city framework.
Fantastic. Thank you very much. Jeff, I'm wondering if we could turn to you, because you've written about the need to build cities better, thinking about many of the issues that Layla has brought up. But you also, in your research, you bring in a discussion, an important one, of urban ethics. And what are the, indeed, one of in your article, you talked about, well, what are the ethics of wearing face masks and such. I'm wondering if you could react to that framework that Layla outlined, and talk about your work in terms of looking at the nexus of cities, as well as issues such as developing the sharing economy, designing cities so that it matches the needs of emerging sharing economy and things like that.
Sure, thank you, El. My work on urban ethics is actually built on prior work by Professor Brandon Barrett and Professor Moritz Ergel from the Ludwig Maximilian University in Germany. Yeah. So my perspective on this, however, is that the way we design cities actually impinge on the kind of ethical issues and problems that we encounter or we create in that process of designing the city in a particular way. Yeah. So in my book, when I discuss urban ethics, I was actually looking at really 6 conditions. The 5th one is more like a normative vision, but the first one would be precarity, which is really understanding that the cities is made up of very uneven economic conditions. And that actually create very uneven, I would say, moral conditions for people living side by side together. Yeah. And what are some of these conditions that can sort of prompt designers, policymakers, planners to think more deeply about ethics? One specific sub-condition of this would be NIMBYism, not in my backyard. Yeah. So that this even though it has a political dimension to this, but I do think that the moral dimension in NIMBYism often goes unsaid, and so I wanted to surface it. The second condition that I mentioned is propinquity. We are actually placed side by side with strangers whom we do not know. And we know really from research in moral psychology that the further the person is, the more we feel, I suppose, less obliged to help out in a difficult situation. Yeah. And we know that proximity, the whole idea that a difficult situation becomes visible to us, all this again impinges on our moral faculties in ways in which only the city can do. Yeah. Then the third condition that I brought up in the book is on conflict. And we all know that the city is a hotbed of conflict. How we go about solving the conflict, either through a consensus approach or through a compromise approach, or perhaps even through a process of perpetual constructive conflict, or again have moral implications of how we conduct ourselves in our urban lives down the road. Yeah. The 5th is actually very interesting, or the 4th condition is actually interesting, is the idea of serendipity, that in cities we actually meet or encounter experiences that is outside of our expectation. And one of the things which actually interests me a great deal is the moral encounter, that we are sometimes often given opportunities to help or to reject helping. And this again, I suppose, shapes us and modifies our own moral faculty. Yeah. And the following that, there is the condition of fear. The city is actually one of these places which I suppose modulate fear in very different ways. One is a fear of the stranger. One is fear of, for example, the catastrophe, the natural catastrophe. When I wrote this book, the pandemic hasn't quite emerged yet. But however, now clearly the pandemic is actually one source of fear in the city that actually reduces our sociality and through distancing. And we tend to, I noticed that when I go out these days with the mask on in Singapore, strangers actually don't want to talk to you. They use gestures. Yeah. So you can sense that the whole idea of sort of utterance becomes sort of this rather apprehensive act. Yeah. And then the final condition I call the urban commons, and that is really where sort of dovetail into my work on the sharing city. That the idea is that yes, there are all these conditions that modulate our moral faculties, but that there is also a hope in which we can the city is perhaps in other words, the city offers condition for all of us to contemplate on our ideal moral prospects. In other words, it gives us a certain vision that we can sort of work towards that can improve our current status quo. And it is only in the city that we can do that. Yeah. So to kind of wrap all this up, I think the urban ethics framework can be summed up by the fact that the city offers us very different kinds of choices. And that the way we make our choices, how we decide and go about making these choices actually have great moral implications for us. So to give an example, in Singapore, we have the Dover Forest case, in which really there is this basically secondary forested land, and there was a public debate on whether it should be devoted to housing or it should be sort of given to a green space, totally given how important green spaces are in the during the pandemic. Yeah. And if you look at this set of choices, both choices are good, but we can we have to make a choice, right? So at the moment, the public policy or the policymakers have decided with true public consultation that it will be devoted to 50% housing and nearly 50% to green, yeah? And that in a sense, it reveals a kind of distributive logic that again, not only reveals our moral preferences, but it serves as I suppose, the future platform for making ethical decisions in the city. So we can't have everything. We have to make choices, and those choices actually have a moral dimensions to them. Yeah.
Right. So tell me, what do you see as the key lessons then from COVID-19, as far as you're concerned, in terms of ethical behavior in urban scapes, or what needs to be done by policymakers then to adjust for those ethical challenges that have arisen from the pandemic?
Oh, I think there are many, El. I think one of the issue in which people can find consensus on is that I think no one can reasonably reject the need to save lives. Yeah, so I think this is basically one of these moral consensus that you will find in very different populations across the world, and I think across culture as well. Yeah, so I think the pandemic has brought up this this very visible and salient area of moral consensus. Then the other more treacherous and perhaps trickier one is the vaccination differentiated policies that are being sort of practiced around the world. In different cities, and I do think that this impact and impinges on urban access. Yeah, so it is indeed right that we want to create our city to be as accessible to as many people as possible, to be as inclusive as possible. But however, because of the pandemic and because of the interleaving of this vaccination, differentiated policy, this is starting to sort of I suppose, impose a certain schism, an artificial schism within the city, in which, yes, the blueprint says that it is inclusive and all-encompassing, everyone can have access to it, it should be included. But however, with this artificial barrier or threshold imposed by the vaccination differentiated policy, suddenly, we have a group of people that can now enjoy, I suppose, the joys and the wonders of the city, but I suppose on the curtailed basis. But you have another group which are almost considered pariahs or outcasts within their own city, and I do think that is indeed going to be a very tricky and difficult problem or challenge later on.
Thank you. Layla, I'm wondering if I could, before going to Amit, if you might react, because I think there's some connection here with some of the things that you talked about. I mean, particularly, I just off the top of my head, the neighborly aspect of a city. I'm wondering, and the inclusion model. I'm wondering if you could just react to what Jeff has been talking about.
Yeah, I mean, I think that COVID has brought us both challenges and opportunities when it comes to making cities more supportive of our mental health and, of course, our physical health too. When I was listening to Jeffrey speaking, I was thinking about the opportunities to improve neighborhoods. So, as we've discussed, the neighborly city is a really important component of this whole approach, but we know that COVID has a distancing effect, so that is one challenge, and obviously there is a role for urban design and planning in trying to improve that, and we've seen lots of interesting pop-up approaches. So for example, pre-COVID, we all know the fight that everyone has on their hands when they want to take even 1 inch of road away from cars and use it for some other purpose. Whereas during COVID, it's been much easier to make temporary changes, for example, to widen pavements and sidewalks so that people can walk safely, or to create temporary bike lanes so that people can avoid public transport and move around the city. And I think that by creating those temporary interventions, people are seeing actually those are quite good. They're improving our neighborhoods, they're improving our life. Maybe we could permit this sort of thing in the longer term. And I think that the other thing that I'm thinking about is we've seen during COVID quite a lot of home working and changes to how people use the city. Pre-COVID, if you lived in a city, you just sort of assumed that you had technically had full access to the whole city and all of its opportunities. Now that people have seen what happens if you were locked down, or even if you end up working from home, then your neighborhood becomes so much more important. You can't just say, I'll just live in this random block of flats and not care what's around me, because I can then travel to all the good stuff in the city. If you're actually going to be spending more time in your own neighborhood, then you care a lot more about the quality of the amenities, of the surroundings, of the relationships that you develop. And I think that that makes people more interested in investing in those at the neighborhood level as well as at the city center level.
Interesting. Now, Amit, Dr. Wanchoo, if I might come to you, because you really are kind of on the ground as a public health specialist, someone who works very much in the philanthropy space, charity space. And indeed, you focused a lot on providing services that may not have been available. I mean, I'm talking about your sort of ambulance service to many people in this developing economy context. I'm wondering if you could talk a bit about your own experience in a city that's very complex and has a lot of geopolitical issues involved, has a lot of social challenges, and how that kind of urban area provides a particular challenge for delivering public health.
Thank you. And in fact, I would like to start with what Layla and Jeff mentioned. See, I'll tell you my personal experience that lockdown, we have been experiencing lockdown for a long time here, and many a times you don't have even internet access. So there's hardly wherein you can interact. And I will tell you, even me or anyone, as Layla mentioned about something like green cities. So whenever you are in lockdown for a long time, even in my family or anyone else, the break that you get is that you would like to go out and go to a green space. In Kashmir, you have beautiful gardens and flowers and places. And telling you honestly, there is a lot of change, even in the attitude or the behavior of the people once they come back home. Same is for the blue cities she mentioned, like going to Dal Lake or going to Nagin Lake, going for a boat ride, and that voice of water, it really soothes the inner, soul of people, and they feel very relaxed. And one of the most important things I have to share here about our place in Kashmir is neighborhood. In Kashmir, we used to have lockdowns for months together, and then you don't have things wherein you can interact. So even we have small mohalla, we call a locality committees, wherein, say, a local shopkeeper, because when it's closed, you can't go out to many places. So the local shopkeepers always keep the stock. And then you have families who cannot afford to purchase, because in any lockdown, financial is the first problem that happens, then is the health, and then our rest of the other problems. So we used to have these committees which will basically pool in money and support this family for a month or 2 months. So you have two types of people or two types of employees here. One is the government employees whose salary goes on, they get it, even in lockdowns. And then you have the people who are in the private sector, and obviously their salaries don't come regularly. So these government people would support these private people in the neighborhood, and that's how they would survive. So in any lockdown, I personally believe that now the time has come when the concept of city has to change. See, definitely in UK or maybe in Singapore, things are a bit different. But when we see in India, South Asia, Africa, and Latin America, the problem is the rush of people who are from lower socioeconomic background to these cities. Even if you do anything, you are not able to control them, because we saw in COVID, we were teaching social distancing, we were teaching hand wash. Now, how can you expect a person from lower socioeconomic doing hand wash when unfortunately he or she has no running water? So in such situations, we have to think in a reverse format, because I personally believe that you have huge, beautiful spaces, whether it's rural or suburban, wherein we have to think of certain aspects in the reverse manner. In such places like South Asia or Africa, where the number is very big, because we have people who go to cities, just first option is to earn money and then to support their family either back home, or they get their cousins, their brothers, and then they do all kind of labor related, technical related works. So how are you going to balance, even if you provide so many things, because the number of people coming to the city is huge, and then we cannot control it. So we have to shift the focus somewhere else, decentralize, decongest these areas in a way so that people can then follow. I'll tell you, like, say we provide ambulance services even when there is lockdown and when there are lots of mental health problems, because I have seen in any lockdown, people, like two sets of patients, we have faced lots of issues. One is the cancer patients whose chemotherapy dose is going to be there, or who have to take a radiotherapy, or people who are suffering from mental health disorders. Because when they are in these closed and choked spaces, they start behaving in a very, very wild manner. And unfortunately, that time you cannot help them much. And that's when we get calls for ambulance services or things like that, wherein we try to interact, or we try to get the doctors into that particular locality, because in lockdowns, it's very difficult to move on and take on care of things. So I personally believe that, as and Jeff mentioned, that mental health, physical health, urbanism, we need to now change this whole dimension. Because personally, I have seen that socially, we have seen in COVID also, it has given us lots of challenges, but lots of opportunities as well. Like you can have hybrid model of working, you can have many other things. But equally, we as human beings need to chat, need to sit in front, need to share some time with our family, need to share some time with our friends. And when COVID was there in India, I can talk, we had people from poor strata who had no space to go where they could even have social distancing. Like the COVID patient was also in the same room, and other whole family was also in the same room because there was no area. So I think the time has come when we have to improve healthcare in such regions, and something like what I call, like feel good space, which should be a part of maybe a hospital or maybe a nursing home or maybe something wherein especially people who can't afford a good housing, who can't afford anything during these pandemics, because the rest of us still manage. Like in Kashmir, we have an advantage that we have still big houses. So in COVID, if any family is suffering, at least one is in ground floor, the others can go to first floor or do something like that. But people, we have a lot of people who don't have even that space. And I'm sure in many these cities all across the world. So I think we have to think that way also. Maybe today COVID is there, tomorrow there'll be another pandemic, day after there can be any other, and they will keep on coming. And somewhere we may need social distance, but somewhere we may need interaction as well. So the time has come that we need to work on that. In these 2 years, we run along with our associate fellow, we ran this OK Minds. So Dr. Nimisha and me, we have been doing these workshops in Hong Kong, in India, and all across the world. And you will see that the challenges, right from children to adults to aged to people who are working, are enormous in this COVID. The only good thing that I'm seeing COVID has provided is an inward journey for people now. People have started becoming careful about their health. Some people are going into the spiritual aspect of life. Some people are going more into yoga. People want to have a healthy food. They want to have some healthy eating, and all these digital things, and that they were too much before COVID. They have tried to reduce that. And how long, I don't know. And one good thing was that in Delhi, you know how polluted Delhi is. But when we had this 1 year break, Delhi had clear skies. Delhi had clean air. Delhi had like people were just clicking pictures and posting on the Facebook or Instagram saying that we have not seen such a sky in our 25 years of life. So that's why I feel that now the center has to change. The concept of city has to change.
Right. So let me ask you then, and I'll ask Layla and Jeffrey the same question. If you're talking about changing the concept of the city, and yet, we have cities already that are built, and does this mean that we need to rebuild or have some kind of creative destruction in order to regenerate the cities? Or do we have to make do with what we got and somehow reconfigure, somehow change practices? I find this fascinating because, of course, it's the same issue with regard to climate change, right? You've got climate change, and our cities are typically not really organized or built in a way to address the climate change challenge. So we have to do things. Now, does that the same thing apply for this sort of public health imperative, that we need to find ways to not just make do with what we got, but we need to rebuild in some way? Amit, I'm wondering if you could tackle that first. Right?
See, my concept, as the two panelists mentioned, is a supporting network. Whatever city is there, I'm not going to change that overnight or do things overnight there. But we have to think that the rush of people that is still towards the cities, the kind of industries that you are building, or the kind of economic options you have, we have to go away from cities with those environment friendly and agriculture friendly options. Because there are so many people, instead of having any setup which they can set up in a suburban or rural area, they still also go to city. So you have to identify now that, okay, this is something which, say, a marketing office is required in the city, but the other part of the office can be in the rural area. That's how you will basically try to segregate people, and that's how you will try to control people. Similarly, in the public health, you must have seen that in this year, April, the health structure almost crumbled in Delhi. Like, I lost my friend's father, I lost, like, we could not get just a 1 hour oxygen. People were just requesting, can you give us 1 hour oxygen? Can you give us 2 hour oxygen? Going into the ambulances, and I just had lots and lots of such things. I just remember people we lost. And the reason was that we never ever focused on our health sector, especially I'm talking right now about India, as well as the preventive measure, as we call it in our medical terms, social and preventive medicine, which has not been an important aspect. And neither we care about such aspects. So the time has come when the spending has to be a lot on health rather than on so many useless issues that we go into. And you have to create a health infrastructure, because we lost so many people in rural areas as well.
Yeah.
Initially, there was no COVID in rural areas, but then we had migration of laborers from all the cities because the labor was coming from rural to this area. And then there was huge migration, and they took away with them all the COVID related cases. And in villages, we have lost so many lives we don't even know. No one was even tested. Like, piles and piles of people died. So we have to stop it somewhere. And I think it happened in other parts of the world as well. So the time has come wherein you have to keep public health as first priority. Then only things will happen. And we are going to face such pandemics again. It's not that COVID has come or now Omicron is there. Maybe tomorrow another thing will be there. So we have to be prepared.
Right. Thank you. Layla, I'm wondering if you could chime in on this issue. How do we build back better, as how do we really address the fact that we have all these legacy infrastructure, the legacy urban design? Do we have to make do, or are there actually real things that we can do to change things?
Well, of course, it's interesting, isn't it? Because you could create a city completely from scratch, and that brings with itself opportunities. But what is really important about cities is the history and tradition and people's memories and people's personal history within the cities. There's lots of research that tells us that when people have come up with big new developments and flattened what has been there before, that has been really negative for communities. So really, it seems from the research that what is important is to work with what you've got and to look for opportunities to tweak those things and develop them in order for them to be more supportive of your physical and mental health. And as Amit said, that should absolutely be a priority. We need to be investing both in healthcare and also in prevention of health problems. And that is an approach that goes all the way across so many different specialties, including those related to the built environment. But this is about thinking, oh, there's some little stream there that's really dirty and nobody goes to it, but could we actually clean it up, create a walking path by it? Oh, there's this housing block that's perhaps doesn't feel like the sort of place that you would want to stop and chat to your neighbours. Could you create more pleasant communal spaces that are more amenable to social conversation with your neighbours? It's about looking for the opportunities to apply the principles rather than starting from scratch, because what we already have is complex social structures, complex social histories that give meaning to a place. And that is also really valuable. So it's about applying all those principles in the different ways to try to move forward. Of course, if you are creating a city completely from scratch, that's clearly a different question. But I certainly wouldn't advocate getting rid of any part of the city in order to deliver this.
Yeah. Can I ask you, because in the UK, I may be wrong, but I mean, I lived in the UK some time ago. I believe that there are some cities that have really regenerated themselves and in ways that have made them much more pleasant places to live. I mean, I'm thinking about a place like, sorry, I don't want to name names, but like Birmingham, say, or Manchester. I mean, that they've kind of regenerated and they're now much more pleasant than they used to be, right? Both in terms of the safety, but also just in terms of the ambiance, the environment, and things like that. I'm wondering if you could identify any kind of best practice cities that we should look at. And maybe don't talk about Singapore. I get Jeff to do it. but if are there particular cities that, in terms of what you're talking about, we should look at and really learn from?
I mean, some of those cities that you're thinking of, I guess that some of the reasons that regeneration has been successful there is that first, they've been sensitive to what has gone before. They've not just got rid of stuff, but they have thought, how can we improve public spaces? Improving public spaces is just the really important focus here of making cities better places to live. And when I'm looking at different cities, I mean, people often ask me, well, what's the best city that incorporates these principles? And I never give an answer, because I think that some parts of some cities do a really good job, but I don't think there's any city that's absolutely getting all of this right. It's so complex, isn't it? But I quite often like to point to Barcelona, which is delivering this concept of super blocks that some of you may have heard of, where they're trying to keep the traffic out of residential areas and just keep it to certain streets, improve for public transport, but really invest in this sort of multimodal streets where you can walk, you can cycle, you can go on your scooter, there's more green space, there's more bumping places, they call it, places where you're going to encounter your neighbours and have the opportunity to chat to them, aiming for some smaller shops and amenities. Ideally, lots of the amenities you might want, your doctor, your library, are within walking distance within those areas that have minimal traffic. And I think that that's a really interesting model that lots of people are looking to. There's also been lots of changes as a result of the pandemic, as we've previously discussed, but everybody at the moment has their eyes on Paris, because Paris has really made quite a revolution in terms of walkability and cyclability during the pandemic, and people are really interested to see whether these become permanent and how that affects the entire city.
Thank you. Now, Jeff, we often think of Singapore as almost like the paragon of urban planning that takes all of these things into account, and indeed, if we think about the contact tracing apps, and you already actually mentioned the forest example, right?
The Dover Forest.
The Dover Forest.
Yeah.
Tell us a bit about the challenges that Singapore has had in terms of addressing some of these issues, and indeed the pandemic as well, because it's not just about the urban design, but indeed some services like the contact tracing apps and such that are needed to get people less stressed about wandering around, right?
Oh, I think you are right to say that I think Singapore is one of the thought leaders in thinking about urbanism in the 21st century. But I do also think that the lessons that that Singapore may offer the world is not it cannot be easily generalizable to other contexts without some modifications or changes. And on this note, I do think that in Singapore we are also facing certain challenges as well. So back to the example of the Dover Forest urban planning case, there was in fact an upswell of let's say popular opinions from the public on what should be done. And I do think that the planning institution in Singapore has over the years been adjusting to accommodate, I suppose, more feedback, more insights, more knowledge from different segments of the society, and in order to, I suppose, reach a converged position with what is sort of what people actually would like. Yeah. So, but nevertheless, I do think that in that particular case, we also see, I suppose, certain limitations and fragility within the planning institution, which I hope the policymakers will sort of take steps to correct. But it may mean for future large-scale planning exercises, the public's insights, the public's opinions and feedback might have to be sort of taken far earlier in the planning process. Yeah, without really in a very early stage preempting what the site should be. Yeah. So I do think that on that note alone, Singapore is, has its own share of developing plains, but I do think that the direction is probably a sound and prudent one towards a city that is, that offers affordable housing, equitable and democratic access to green spaces, and which people actually enjoy a very high level of urban living. Yeah, so I do think that the pandemic it has offered us or presented certain challenges, but I think I agree with Dr. McCay that we shouldn't go back to the drawing board by sort of through a process of creative destruction. If the history of modern architecture and urban design or urban planning has taught us anything, the examples by Le Corbusier and Robert Moses is probably not the same kind of lessons that we want to kind of go through again. So I do think that working with what we have, looking at it in a very surgical and tactical manner, connecting spaces of, for me, spaces of commoning, spaces of sharing, creating an archipelago of common spaces and interests. I think that would be a more strategic way to, I suppose, to rework institutions, rework human social relations in relation to the built environment. I think that would probably be a more strategic exercise rather than something which is that requires wholesale infrastructural overhaul. Yeah. Also in relation to climate changes.
Right. I guess I'm thinking about Singapore's renovation of housing estates, right? HDB flats and things like that, which is probably, I would guess, a world-class effort at upgrading public housing. And they took into account a lot of the issues that sort of Layla, I think, brought up.
Right.
And the need, yeah, go ahead, sorry.
No, actually, this is an excellent point. More recently, in a particular northeastern public estate in Singapore, the urban designers and urban planners and policymakers have created or planning to create a dementia-friendly estate by, I think, 2025, if I recall correctly. Yeah. So that means that if you are living in this, public estate, the block numbers will be, painted in brighter colors. They'll be in bigger fonts. And for people who is, who are the part of the population who may be suffering from early onset dementia in the near future, this will be sort of a place that will be very inclusive for them, and I suppose very convivial for them to continue to live in the estate rather than to move into a care home somewhere. So I do think that the urban design thinking has sort of gone into, I suppose, sprucing and improving, the built environment in ways that that is perhaps more conducive and more compatible to segments of the population that once might have found trouble, living in, normal environments. Yeah.
Right. Thank you. There is a question from the audience, from someone at the Sir John Kotalawala Defense University in Sri Lanka. And this question is to you, Dr. Wanchoo, to Amit. The question is how poverty plays an indispensable role in the discussion of urban planning in South Asia. You touched this to some extent, and the question here is, due to rising population in cities, the capacities to afford the required assets have been reduced. On the other hand, even during COVID-19, there have been sort of undergoing social and mental issues have been impinging on residents because of the congested nature of these cities. So how would cities sort of tackle this? This particular problem, the congestion doubled with the combined with this sort of social and mental stresses?
See, as I mentioned, that we know in South Asia also that the people from lower socioeconomic strata always have this as a challenge. We have seen in COVID also, and this I have seen practically in hospitals also, especially in private hospitals. People who have money can do so many things, and people who don't have money, they are not able to do. And this is unfortunately the truth. And that's why we have also lost many lives. And one of the important things, that's why I mentioned people from lower socioeconomic strata, the most important thing that they basically are concerned about is finally the healthcare and the expenditure involved with the healthcare whenever such pandemic comes. And that's why I was saying that we need to have spaces for them wherein at least the healthcare for them is in a range which they can afford, because that is one of the primary concerns. And in that, even the people who basically employ them also have to play a role wherein you give them health security at least. And that's how these people are available to you for all kinds of working. Now, as far as the general aspect is concerned, that when we have such kind of pandemics and or the cities are congested, how we deal with that. In that, I think, as Layla also mentioned, that there are spaces that you have to create. And Jeff also mentioned now in cities wherein you can have those spaces to basically fill your soul and get relaxed and have that, place wherein you can share your inner thought. Because we have seen majority of the cases when there was lockdown, say we have domestic workers who are working even in Hong Kong or even in Singapore. The major issue was in lockdown that they had so many fights with the people who were their employees, and they even beat them because of one or the other issue, or maybe there was a mental health issue with the employer as well. And that's one of the issues which we face in South Asia as well. Or even in a family, you have lots and lots of such things coming up if one person is mentally having an issue, or in your circle or in your professional space. So we need to create these good spaces in the urban areas wherein people can go and share their feelings. And I think Layla and Jeff mentioned those few things which we need to focus on, whether it's green, blue, or neighborhood kind of stuff.
Right. Thank you. I wonder if I could ask Jeff this question, coming from someone who addresses me in Tagalog. So I don't know. He's from the Philippines, but he talks about ancient Chinese having faith in human beings and the, I guess, predilection to accept cruelties or difficulties. And I asked, I think, Jeff, you might be the right person to, they face courageously the prospect of the uncertain future, and they'll just be very Jobian, if I can bring a biblical reference to this, about suffering, right? And how this kind of affects, because I know in your urban ethics essay, you did talk of Boethius, right? And then some of the very similar issues. I'm wondering if you talk a bit about that kind of, is there something about Chinese ethical behavior or Chinese moral imperatives to kind of like just make do, just kind of like the world is tough, so you got to just tough it out?
All right, I have to first confess and admit that I'm not an expert in Eastern philosophies, particularly Eastern ethical theories, but I try. I do think that there are different schools of thoughts, right? In Chinese, you have 百家争鸣, which means it's 100 schools, trying to sort of fight for prominence or relevance. Yeah, there was during the Warring Kingdoms, if I recall correctly. So in those days, you have very different ways of sort of different ways of coping with the human condition, different answers on how to cope with it, and perhaps one of it would be that you have to sort of go with the flow, you have to improvise. You should not sort of force, your own mandate over what is sort of given to you by nature or by the heaven. Yeah, but I do think that this goes beyond a particular ethnicity. I do think that in a very recent book, and I recommend this to anyone who's sort of listening now, and I'm still reading through it. Michael Ignatieff actually wrote a book on. The title is called On Consolation, and it's an excellent book because he was able to draw solely really from the Western tradition, different different schools of thought across history of how different people cope with very difficult situations. And they actually found very different, vastly different sources of consolation. And Boethius was actually one of them. So I do think that this is perhaps not tied directly to Chinese or being Chineseness or the quality of Chineseness, but I do think that any reflective human being facing a particular set of let's say trying human circumstances I would say fall back on the natural capacity, and either you let the capacity cultivate you and train you to sort of think differently, or that it bests you in ways in which perhaps is sort of undesirable. So I do think that this is something, this whole act of relearning how to cultivate this capacity, where do we draw our sources of consolation and sort of mental reservoir of how to cope with this. And I do think that the pandemic has brought this up, and this is perhaps one of the best things if I may say this, that has going that the human race have sort of got have got for a long time. Yeah. So this is one of the best things that this has happened to people for a long time. Yeah.
Right. You referred to Michael Ignatieff, the Canadian philosopher, on consolation, finding solace in dark times, which is an interesting
Thank you.
book.
Yes, that is the title.
Now, if I might close the discussion with you, Layla. I'm sorry, these are maybe big questions that I shouldn't have left to the end, but one question from the audience is, are high-rise buildings destructive to community building? But without high rises, we may even have less public space beneficial to mental health thoughts. And the other question that I thought I would ask is just whether particular needs for inclusion regarding gender and how important that might be going forward. Yes.
Oh, I'm not sure I can cover all of that in 2 minutes.
I know, I'm so sorry. I'm so sorry.
In terms of the interesting question about high rises, of course, at Hong Kong University, you probably have some of the world's experts in looking at the links between high rises, between density, and between mental health. And I know that they have found some links and some challenges, but I don't think that there's a simple answer to that. There are both pros and cons of high rises, and in some ways it's about how you think about the design of those. But there's a lot that's been written out of Hong Kong University on that that's really worth reading. In terms of gender, that's such an interesting question. I'll very briefly give an example of cycling. So when you think about, we want to increase the amount of people cycling in a city, and lots of the ways in which we've tried to do that have been focused on men. So thinking about where the routes that people are trying to go. Obviously, this is generalization, but men will quite often be going from A to B on a work commute. Quite often, women have tended to use bicycles in more of running various errands, going from A to B to C to A, and that really changes, for example, how you think about biking infrastructure. If you think about the cultural connotations of cycling, that can be quite different for women and men. If you think about the barriers to cycling, lots of research has been done that men will say, for example, that the barrier might be where do you hang up your stuff when you get to work? For women, it might be concerns about safety and people harassing them when they're cycling. Obviously, those things are not completely binary. There's a huge mix. But what you see is that you need to take different approaches to addressing the barriers to cycling by taking gender into account, because really the needs and the challenges and the barriers can be really different. And of course, that varies from place to place, from culture to culture, and all that sort of thing. So I think that whenever you're thinking about anything like that, not just gender, but all sorts of differences need to be taken into account.
Oh, right. Now, just before we close, since this is an AGI, Asia Global Fellows event, and we have possibly folks who are interested in the Asia Global Fellows program, I'm wondering if I could ask Layla first, and then Amit, to just talk briefly about the program and what you got out of it and your recollections of your experience as an Asia Global Fellow.
Sure, and I'm looking upon this picture quite fondly because, of course, this is where we spent 3 months of our time when I was an Asia Global Fellow in 2017, which was the first year the program was started. I went because I was really interested in the Asia lens on a range of policy areas. I felt like quite a lot of the learnings that I'd had to date had quite a Western, particularly UK, US, Canada type of a focus. And I was just really interested in coming at some of those challenges from a different angle. I really appreciated being able to meet up with a really interesting set of people with such diverse backgrounds, all coming at this question from a different angle, working on different topics. And I particularly appreciated getting to focus on my topic of urban design and mental health from the Hong Kong perspective and from the wider Asian perspective. I got to spend 3 months doing some really interesting research, which contributed to some papers and eventually to the Restorative Cities book. But I also really appreciated getting to go to lots of lectures from various experts from around Asia, giving new perspectives on topics that I knew, sometimes I knew quite a lot about, sometimes I didn't really, and also the opportunity of traveling to some of those other cities. We were talking there about Singapore, and it was such a treat to get to go to Singapore and see some of those urban design approaches in person. So all in all, it was a fascinating experience, and I found it really valuable.
Fantastic, thank you. And Amit, close us out. Tell us about your experience as a Asia Global Fellow.
Well, for me, Asia Global Fellow was a wonderful journey, and it really opened lots and lots of opportunities as well as knowledge for me. I was interested in knowing a lot about East Asia, and I also wanted to see a place wherein there is a confluence of West and Asia as well. In Hong Kong University and Asia Global Fellows program is such thing wherein you were able, one of the most important things I think of this program was a wonderful networking opportunities that you get. You're meeting people from business, from social, from political, from all other aspects, and they're interacting with you or giving you lectures, or there are morning interactive sessions. And you are able to know a lot in that 3 months time. Like, I have never seen any fellowship program which covers so many aspects in 3 months. And then also gives an opportunity, which is a free hand to do research on the topic that you want. And telling you honestly that that study for me also was such a wonderful thing, and that journey. Then obviously the people in AGI who basically are always there to help you. One of the best thing that this fellowship program has compared to many other fellowship programs I have seen is an openness wherein whatever you want to do, they are there with you. And we had some wonderful program directors, and we have Yuan, we have Professor Chen, or we had Casey, or we had many other people and Joyce who have been there as a family. Like when you're 3 months away, then you basically want to have that kind of setup as well. And then in Asia Global Fellows program, you also get an opportunity to get your families. And then there's also a time wherein you can interact, and the fellows, that the network that you have, I think in last 2-3 years, we together have done a lot. And one of the best things of this program is also that they give you one associate fellow. And let me tell you that with one of my associate fellows, we founded something for mental health. Well, while we were in Hong Kong, we were just talking about it. Then we founded it by the name of OK Minds. And in the last 2 years, at least we have done more than 300 workshops all across the world. And that's what I got through Asia Global Fellows program only. So I would request all of you that apply if you are interested in knowing something differently. That's what this fellow program, this Asia Global Fellows program is all about. Thank you.
Great. Thank you very much, Amit. Thank you very much, Layla. And thank you very much, Jeff. It's been a pleasure to have you. I guess I would close by saying, well, this is an example of that kind of different thinking, and we bring new ideas about urban design and mental health and urban ethics, and urban design, urban services in a developing economy context. These are issues that I personally learned quite a lot, and it's not often that you get really three experts on these topics to come together and kind of exchange notes. And that's what, in many ways, the Asia Global Fellows program is all about. So thank you to our listeners. Follow us on social media, Facebook, LinkedIn, Twitter, YouTube. And thank you, Layla. Thank you, Jeff. Thank you, Amit.
Thank you. Thank you so much. Thank you
And
so
best
much.
wishes for the holidays.
Thank
Let's
you.
not
Yeah,
forget the
same to you.
holidays.
Thank you. Happy New Year
Yeah.
to everyone and
Thank
Merry
you.
Christmas.